Hi, I'm Megan Chavez, the Vice President of Patient and Family Experience at Cook Children's, and we're excited to talk to you about embracing togetherness.
And hi, I'm Jill Koss, Director of Family Support Services at Cook Children's.
And I'm Vicki Kelley. I'm the Assistant Director of the Family Services Department at Cook Children's.
So I think embracing togetherness really is who we are at the end of the day. It's all of us coming together with our different sets of expertise in caring for our kiddos and their community. And certainly that involves our volunteers, which you know so much about.
I'm glad you mentioned families, because I think the other part of that is that families know that we embrace who they are, but they also want to be part of the team. Right. So that's such a valuable part of togetherness, because the families understand that they're part of helping their child get better.
Yeah,
and heal.
Exactly. And we can't do that without knowing them. And they're the ones that are going to tell us what that looks like for them.
And I would even say for our patients, I know families are an important piece of that, but our patients too, that are old enough to tell us what it is that means something for them to be at Cook Children's, and how we also include them and incorporate them into their care and the decisions that they may be making about their care.
Yeah, and I think the amazing thing is we serve so many different kinds of families. Right. And different parts of the community, and so I think really understanding what that looks like for them comes from them. Yeah, and our families tell us too that when we work well together is when they really can trust their care, right? Because they're looking to see, are we all on the same page? Do we know the plan of care? Are we involving them? So it really does take a whole team to come together.
One of the things our families tell us is that they don't necessarily want to just be taken care of, they want to work with. Families tell us that empathy is something that stands out, and when they know that we are empathizing with what they're bringing to us, then they really feel cared for.
Yeah, and I think empathy, even I think about clinical care, so nurses and physicians, providers, other clinical staff. But I think empathy goes a long way too in terms of front desk staff and people answering the phones and all of those other, if you think about the experiences from the first time they call to make an appointment, or that really the experience is empathy is all of that empathy happening all of the time in terms of that. It's not just around the person that's actually providing the care, but phone conversations and meeting people in the hallway and Starbucks. I think about, just on campus in terms of no matter where they are, that ability to people being kind, people being open and generous and how they approach people, but kindness in terms of no matter where they're working or where they're engaging with patients and families. But I think for the years that I've been at Cook, the culture is one of kindness for each other as well, and being able to take that into consideration when it's even more stressful or when it's harder than it has been. How do we take care of each other? And kindness is certainly a huge way to be able to do that.
Again, I think teamwork is just fundamental to who we are. I mean, when you come into such a specialized expert place of healthcare, we're tapping into the expertise of all of us, including our families and our patients as well, and their knowledge. Again, I think as we've grown as a system, and you've got 60 plus locations now, the team's expanded. And so the team isn't just what's happening at the hospital, it's what's happening when you go back to your primary care physician, or when you need urgent care visits in the middle of the night, or not in the middle of the night, hopefully, but so I think just thinking more and more about how we work as a large system that's serving all of North Texas to really understand what our community needs and be there for them when they need us.
Mm-hmm. There's a definition of collaboration that I learned many, many years ago that I've always appreciated, because I think it even speaks to teams. So it's taking the expertise of whether that's the clinical care, the physician, the nurse, whatever, and then the family's expertise for their child, and it's meeting in the middle. But I think about that as teams as well, because maybe taking the expertise of a child life specialist who really understands the developmental needs of a patient, and a nurse who really understands the clinical care. And so what comes together then is what's best for that patient between those two professionals. So collaboration means so many things in terms of, it's not just, we talk about collaboration with our patients and families for sure, but collaboration in a team, and how a team is stronger when everybody has the opportunity to bring their expertise to the center, and that child's what's at the center, and that family's what's at the center. And so I've always appreciated that definition, because it was very visual for me to kind of recognize it's really about how that comes here. We hold our own space, but again, for the child, it's here in the middle.
Thank you for joining us as we discuss embracing togetherness.